This is an introductory talk on the history of medicine and is meant to introduce you to what should be an exciting experience. Unfortunately, in school, the manner in which we are taught history is dates and uninteresting facts like the Battle of Panipat was fought in so and so year and that sort of thing. History can be very exciting. History can be very, very interesting indeed. And the history of medicine is even more exciting and even more interesting because it deals with heroes of the past, individuals who have made advances which we are using today, and oftentimes these advances were made at great sacrifice and at great cost to themselves. And I hope to show you by example some of these giants on whose shoulders we stand. We must never forget that if we practice efficient medicine today, and if we are able to help our patients, it is because of the contribution of so many physicians and surgeons and other medical personnel over thousands of years. And we are indebted to each and every one of them for the advances that we use so readily and so frequently. I'm going to try and concentrate on Indian physicians and the history of medicine in India, but I will make some references to Western medicine and try and show you the advances which occurred in the West as well. This slide shows you past and current physicians who deserve our study and our respect in India. Some of these may be familiar to you. The names of Sushrut and Charak may be very, very familiar to you. The name of Acacio Vegas may not be as familiar, but he is the man who detected the first case of plague in Bombay in the late 19th century. He was ridiculed because the government of Bombay felt that plague could not occur in Bombay. And he had to struggle to make the public and the government aware that the plague epidemic was hitting Bombay. And when it really hit Bombay, there was a huge morbidity and mortality, which the government recognized very, very late, in spite of his work and his attempts at getting them to understand about this epidemic. And Dr. Rustam Jal Vakil was a professor in the institution in which you are at present. He was a physician and a cardiologist in the St. J.S. Medical College and KEM Hospital. And amongst his many achievements was the Lasker Award, which is a very prestigious American award, which he was given because of the efficacy of raw Wolfia serpentina on which he had worked, and how he had shown that this readily available indigenous product in India could be used to lower blood pressure when the existing other drugs were not as effective. So these are just some of the Indian physicians of earlier times. And at the bottom, you see individuals who are doing some remarkable work in public health today, and we will come to them a little later. Let us start with medicine in ancient India. Tradition has it that the science and art of medicine were passed on from the gods. So we have received them from the gods who presented them to mankind along with other forms of knowledge and philosophy in the form of Vedas. And I think, as all of you know, there are four important Vedas: the Rig, the Sam, the Yajur, and the Atharva. And the Veda that we are really concerned with is the Atharva Veda, because it contains whatever we utilize in the art and science of medicine for the promotion of health and for trying to treat disease. And the Atharva Veda and some of the Upanishads, which were based on the Atharva Veda, on the Vedas, were the sources of inspiration for the priestly class. And it was the priestly caste which in the ancient times also served as physicians. Now here is an imaginary drawing which was made many, many years ago, which show the Matsya avatar presenting the Atharva Veda to Charak, who is sitting in the center. And the disciples of Charak are shown on the right. You must remember that these are all imaginary drawings. Nobody knows what Charak looked like or what his disciples actually looked like. We have no authentic portrait of any of these great, past, ancient masters of medicine in India. But this is a genuine page, a page from the manuscript copy of the Atharva Veda. And it is the Kashmiri version of the Atharva Veda. It's called the Paipalara version. And this is preserved in the University of Tübingen in Germany. It is a sad but unfortunate fact that we have very few genuine manuscripts of this kind in India. And if you wish to study them, then you have to travel abroad. The science of medicine at that time was called Ayurveda. And the literal translation of the word Ayurveda is that it is the science of life. Remember, it's not the science of curing disease. It is not the science of medicine. It is the science of life. And so it encompasses much, much more than mere medicine. In the Charak and the Sushruta Samhita, we come across these statements that the science of life, which we today have reduced to the science of medicine, is boundless, it is endless, and it is eternal. You can never complete your study of this science. No matter how much you try, there will be some elements which remain unknown to you and which you need to study. And most important of all, it is an auspicious science because it is the only science which does nothing but help. It helps individuals. It helps them to prevent disease. It helps them to overcome suffering, pain, fever, and other forms of suffering. And sometimes it can save life. Now, this knowledge was based at that time on their understanding of the causes of disease, symptoms, signs, the tests that they had, which by our standards would be very, very primitive, and the remedies that they used. The advance that they had in their understanding of the science of life, which we have lost, is that this science of life should cater not merely to the body, which is what we do these days, or the mind, which is what we do with the science of psychology, psychiatry, and other allied sciences. But for them, the science of life was also catering to the senses and to the soul itself. And it is believed that this science of Ayurveda originated around 2000 years before the Christian era. And the method of teaching Ayurveda was by the Guru Shishya Parampara. Each Guru would have his own disciples, limited in number, and they spent all their time with him. They lived with him, they served him, and they gained from him. And so that was the technique which was used to impart science, including the science of Ayurveda, from teacher to student. The two big names from ancient Indian medicine that have come down to us are those of Charak and Sushrut. Charak was a physician, Sushrut was a surgeon. And here we have illustrations which are imaginary illustrations showing what the artist felt were portraits of Charak and Sushruta. Like I told you earlier, there are no authentic portraits of these individuals. Nobody knows what Charak and Sushrut look like. But these are imagined portraits by artists. And what is really ironic is that the illustration of Sushrut performing an operation on the right side is actually by an American artist named Robert Thom. So you can see that these illustrations are merely meant to be suggestive. They are in no way authentic, and they are in no way representative of what actually was going on at that time, or what these ancient masters really looked like. The science of life, as it was taught and passed on from teacher to student, also incorporated methods for selecting teachers, methods for selecting students, because they had aptitude tests, which we don't have today. This is another major failing in the modern system. But they had this aptitude test, and they would select the student based on criteria which demonstrated that this student wanted to learn medicine, was fit and capable to learn medicine, and would practice good medicine if he was enabled to learn the science of life. And this is Charak's advice to students. You will see that this advice incorporates what we call ethics today. There was no separate branch of medical ethics at that time. Ethics was incorporated into the learning and teaching of Ayurveda. It was a part and parcel of that science. And so the very first piece of advice that Charak gives to the student is that if you wish to achieve success, always seek the good of all living creatures. And you will note that he did not talk only of mankind. He talked of all living creatures, which included animals, plants, trees, and everything else that was living. He also taught empathy, sympathy, courtesy, the right kind of behavior, without using the word ethics or any of these words that we utilize today. And as you see towards the end, he emphasized that there is no end to the learning of Ayurveda. And therefore, it is important for us to devote ourselves to medicine throughout our lives, not just while we are undergraduate students, not just because while we are postgraduate students, but right through whilst we are practicing. And almost up to the day we die, we can keep on learning new facts about this science. And the last sentence, I think, is the most important. He said that you can learn about the science of life from everyone. The whole world is a teacher, if you are willing to learn from them. And if you are wise, then you will be willing to learn from them. Even in those days, they used to have meetings of Ayurvedic practitioners. And there was learning and teaching by discourse. They used to discuss, they used to argue, they used to put forth their experiences and their points of view. But all this was done in a spirit of learning. There was no one-upmanship. There was no urge to put down somebody. There was no urge to ridicule. The predominant inclination was to learn from everybody and the experience of everyone. And you will see right at the bottom of the slide, there are young children who have been brought in to watch these discourses and to see how learned discourses and meetings and what we would today call seminars and conferences can be held in a spirit of give and take. Unfortunately for us, after a certain period of time, after the passage of some several hundred years, the ancient masters of Indian medicine, and there are many of them, and I've just listed a few, Charak Sushruta Bhagbat, the Ashwini Kumars, the Bela Bhagbat, Jivak. This spirit of inquiry, which animated these old masters and these old teachers, this spirit of inquiry disappeared. And innovation gave way to learning by rote. Learning by rote means mugging up. You just mug or assume or accept whatever is given to you by your teacher without asking any questions. You memorize it and then you practice. So naturally, as you can see, when the spirit of inquiry and innovation disappears, then medicine stagnates, as any science would stagnate. If there is no spirit of inquiry, if there is no spirit of innovation, then that science tends to stagnate. And so that is what happened in India as far as medicine was concerned. I've used some other disciplines of medicine in comparison. Islamic medicine reached its peak between 800 and 1200 after the death of Christ. And then it too stagnated. And Unani medicine, which is based on the ancient principles of Greek medicine, was introduced into India between 1200 and 1400 by the invading Turks, Afghans, and Persians, but it too did not progress the way it should progress. With the result that by the 16th and 17th century, Indian physicians were divorced from the principles of inquiry and of experimentation. And this is just the time when the spirit of inquiry and the urge to experiment was mushrooming in the West. And so around the 17th century, we had a scientific revolution in the West which completely bypassed the Indian subcontinent. And so around 1500, 1600, 1700, even in 1800, this was the kind of medicine that was being practiced. And I'm just showing you one slide to show you what our understanding of anatomy was at that time. Very, very rudimentary and certainly not at all true to what actually obtained in the human body. And this is how practice, clinical practice, was carried out from the 16th to the 18th century, and perhaps even in some parts of the 19th century. So most of the diagnosis was made, as you can see on your left-hand side, by a study of the pulse. The medicines were compounded out of vegetables and roots and barks of trees. Surgery was very, very elementary, but it involved the treatment of cataracts by a very crude and rudimentary operation, which, however, was able to restore sight in some cases, whilst it destroyed the eye in many other patients. And so even in the late 18th, 19th century, you had physicians who practiced in this manner. They had an advertisement which showed some bottles of medicine and a mannequin, an anatomical mannequin, and the physician would sit in one corner till his patients turned up. Meanwhile, in the West, universities were springing up. And if you look at the left, you will see the dates on the top, founded in the 12th century, 13th century, 14th century, 15th century. And universities were being set up in Oxford, Cambridge, in Europe, in Basel, Heidelberg, and Bologna in Italy, which was the oldest university which was formed in Italy. And even in Portugal, we had Coimbra and Lisbon as developing universities. So universities were springing up in the West, and thought was encouraged, experimentation was encouraged, questioning was encouraged, and innovation was encouraged. No wonder that with such a spirit and this kind of an atmosphere, medicine zoomed ahead, and the understanding of anatomy, physiology, and our understanding of the science and art of medicine progressed by leaps and bounds. So, whilst in the earlier parts of the Christian era, we had Claudius Galen, who is seen on the top left-hand corner, who wrote many, many books on medicine, but who made very major errors in his anatomical descriptions. He believed, for instance, that the liver was multilobular. He believed that at the base of the brain, we have something called the rete mirabile, which doesn't exist in human beings, but it does exist in some animals. And the reason why he made these mistakes was that he dissected animals and extrapolated those facts to human beings. Because in some animals, the liver is multilobular, he said in human beings also the liver is multilobular. Because some animals have the rete mirabile, he said human beings also have the rete mirabile. And it was only in the 16th century when we had this great anatomist, Andreas Vesalius, who carried out human dissections, because he was enabled to carry out human dissections. He was permitted to do human dissections. Some human dissections he did clandestinely as well. But on the basis of his experience with dissections on human bodies, he created a masterpiece on anatomy. And that masterpiece on anatomy, which was created by Vesalius, changed the understanding of anatomy forever. So Vesalius really is the founder of the anatomical knowledge that we possess today. A man greatly to be honored, because some of these dissections, which he did clandestinely, if he was caught dissecting those bodies, he would have been hanged. So he did some of these dissections at a risk to his own life. Then, of course, we have experts in other areas. We have Ambroise Paré, who lived in France and who was a surgeon who was very famous for his treatment of wounded soldiers on the battlefield. We have William Harvey, who understood and described the circulation of blood in the human body. Till his time, till his period, which is over here, the knowledge of the circulation of blood was very, very rudimentary and very, very illogical at times. because there was a belief that what circulates in the human body is what they called animal spirits. And some of these animal spirits were said to be vapor. So there was vapor and animal spirits circulating in the human body. And it was William Harvey who showed that what actually circulated in the human body was blood. And he also showed what the purpose of this circulation of the blood was. Then on the lower left, you have John Hunter, who continued from where Vesalius left off as far as the study of anatomy was concerned. He did a lot of work on comparative anatomy, dissecting a variety of animals and birds and describing their anatomical features. And of course, he was a brilliant surgeon. He also was very fond of collecting specimens for the creation of a museum. And that museum has persisted up to today. And if you visit London and you go to Lincoln's Inn Fields, to the Royal College of Surgeons of London, you will see the Hunterian Museum with some of his collections in that museum. I say some of his collections because a significant number of his specimens were destroyed during the World War when this museum was bombed. And so several specimens were destroyed in the bombing. But we have enough specimens to be able to realize what a great physician, surgeon, anatomist, pathologist Hunter was. Next to Hunter is Louis Pasteur. I think all of you know about Louis Pasteur and the birth of the science of microbiology, bacteriology, the understanding of fungi and the changes that they produce, and so on. Joseph Lister was a Scottish surgeon, and it was he who developed the concept of antiseptic surgery. Till his time, wounds were prone to get infected. In fact, when an operation, a surgical operation was done, it was expected that the wound will get infected and pus will come out of that wound. It was expected as part of the normal process. And they also used the term laudable pus. That means this is good pus which is coming out. And it is after the work that was done by Pasteur that we understood that if the wound gets infected, it is because microbes have entered the wound. And Joseph Lister showed us how to prevent microbes from entering an operation wound. And he created what is known as the carbolic acid spray. So there was a spray which was in the operation theater, and that was made to pour out a spray of carbolic acid continuously in the operation theater so that the surgeons and the wound and everything was covered by carbolic acid in a fine form of mist, very small concentration, but enough to prevent infection. And Joseph Lister for the first time showed that it is not necessary for the wounds to get infected. In fact, it is not a good idea to get the wounds infected, and there is nothing laudable about pus. The last example that I have used of these Western giants of the older period is Wilhelm Conrad Röntgen. And we revere Röntgen because it was he who discovered X-rays. And it was X-rays which helped us in so many ways. Once X-rays became available, we could see the inside of the living human body. And it was the advent of X-rays and then everything else which came after the discovery of X-rays, including the most modern equipment such as the CT scan, that diagnostic acumen has improved by leaps and bounds. So that is Röntgen. the discoverer of X-rays. And it is said that the very first X-ray that he took was of his wife's hand. And that X-ray shows the wedding ring on her hand. And of course, it shows all the bones of the hand. Röntgen. After them, of course, there have been a whole lot of other great physicians, and I can't possibly talk about many of them, but I'm going to tell you about a few whom I respect as heroes. I honestly feel that they are remarkable individuals. And the first is Rudolf Virchow, who is on the top left hand, German pathologist. And Rudolf Virchow not only studied pathology, but he studied tropical medicine. He came to the East to investigate diseases like the plague and cholera, and left a body of work which is rewarding to study even today. There are still things that we can learn from Rudolf Virchow's archives. Right in the center on the top is Sir William Osler. Osler was a Canadian physician, and he then was appointed as the first professor of medicine at the Johns Hopkins University when it was founded in Baltimore in America. And he was the professor of medicine there. And eventually, he was appointed Regius Professor of Medicine at Oxford in England. Now, the Regius Professor is a distinguished post which you cannot apply for. You are selected and you are appointed. And as the term suggests, it is a royal post. And William Osler was the Regius Professor of Medicine at Oxford till he died. He has many claims to fame, but two of them that I would like to highlight and bring to your notice are his love for the history of medicine. He taught medicine in every possible way, including by producing a textbook which became what was like the Holy Bible for physicians all over the world. But in this textbook and in most of the talks which he gave, he always started off by a historical review of the subject, whatever it was. He amassed a huge collection of books on the history of medicine. And his library, after his death in Oxford, was transferred to Canada and is now placed in what is called the Osler Library. It is named after him in the city of Montreal in Canada. So if you do visit Montreal in Canada, do not forget to visit the Osler Library. It is an amazing place full of all kinds of material on the history of medicine, including, of course, his books. On the right, you have, I told you that Osler was, I would like to recommend two aspects of Osler to you, quite apart from his skills in medicine and all that. And the second aspect that I would like to commend and bring forth to you is that Osler was famous as a bedside teacher. If you read his biography, you will find photographs of him with him at the bedside and a bunch of students and residents around him. He believed that medicine can only be learned at the bedside of the patient. You cannot learn medicine from books. You cannot learn medicine from lectures and talks. You can only learn medicine at the bedside of the patient. And so he was an ardent advocate of bedside teaching. And I feel very, very strongly that his emphasis on bedside teaching was absolutely on the dot. It was absolutely perfect. And I follow his advice that you cannot learn medicine except at the bedside of the patient. Today, this bedside medicine is beginning to get a resurgence even in America, where for a while everybody depended on computers and looked at screens and looked at reports on the computer screen, ignoring the patient completely. But there is an Indian physician in America. His name is Abraham Verghese, and he is bringing bedside medicine back into the American consciousness. And he has succeeded to a considerable extent, so much so that he has been given the American President's Award for his attempts at bringing back bedside medicine into American medical colleges and hospitals. So William Osler, history of medicine, bedside teaching, much, much more. There is much, much more to Sir William Osler. There's so much more to learn from him. Fortunately for us, he has written several books, and there are several books written on him, from which we can learn more about the man, about the work that he did, and about his teachings. Just last year, a huge encyclopedia has been published in America. It's called the Osler Encyclopedia, with many, many, many entries on aspects of Osler's life and work. On the top right-hand side, we have Sigmund Freud, and I think all of you are very, very well aware of Sigmund Freud, psychoanalysis. Sigmund Freud lived and worked in Vienna for the early part of his life, and later moved to England, where he died from carcinoma of the tongue. I don't think I need to talk about Freud, because I'm sure all of you know about Freud and psychoanalysis and so on. Bottom left-hand corner is Sir Alexander Fleming. So Alexander Fleming, and I'm sure many of you know this, is the one who identified from a Petri dish which had been left open in his laboratory overnight. And on that Petri dish, you can actually see in this photograph, he's holding that Petri dish aloft. You can see it here. Here is the Petri dish. And on that Petri dish are colonies. And these are colonies of a fungus. And that fungus is Penicillium notatum. And it is from this fungus that we derive penicillin. And the reason why we sought penicillin and derived it and started using it and manufacturing it is because Fleming noted that around each colony of penicillium, all the other organisms had died. All the bacteria had disappeared from the Petri dish. So this penicillium was secreting some chemical which was antibacterial. And so we have the science of antibiotics, which developed from Fleming's observation of penicillium and how the secretion from penicillium destroys germs. I've particularly put the lady in the center of the bottom row. Her name is Elizabeth Blackwell. She is the first lady to storm what was called the medical citadel, the medical fort. The education in medicine was strictly restricted to males. No woman was allowed to enter this field for a number of reasons that they felt were logical at that time. They felt that ladies were too delicate to be taught human anatomy, particularly genital human anatomy. They felt that ladies would not be able to withstand the stresses and strains of medicine, that they would fall ill and they would give way under those kinds of stresses. And Elizabeth Blackwell, for the first time, broke through all the barriers that were put in her way and eventually graduated as a physician. She opened the way for all other women to enter medicine as medical students and become doctors. And today we know that the example that was set by Elizabeth Blackwell has yielded such rich dividends, because we have had so many remarkable medical clinicians, medical researchers, and even women surgeons who have done extraordinary work. So Elizabeth Blackwell, who opened the doors of medical colleges to women. I've purposely put this gentleman on the bottom right, Sir Ludwig Guttmann. Sir Ludwig Guttmann settled in England, and there he set up, for the first time, because this was not a common practice at all, he set up a center for treating paraplegic patients. And Ludwig Guttmann's center has eventually become the model for all such spinal injuries centers throughout the world. Up to that time, paraplegics and quadriplegics were kept at home in an isolated room where they developed bed sores, urinary tract infections, lung infections, and eventually died. So the future for somebody who becomes paraplegic, and even more so for somebody who becomes quadriplegic, was zero. There was no future. They would die. And they would die miserable deaths, because the bed sores would get infected, there would be pus, the whole room would be stinking, the urine would be infected, and that in turn would create infected and stinking bedclothes, because they were also incontinent. And so it was a horrible, miserable death. Ludwig Guttmann and his colleagues and his followers have enabled paraplegic patients to stand and to walk using all kinds of crutches and supports and aids. And now today, of course, we have robotic means for making these individuals sit and stand and walk. So Ludwig Guttmann changed the future for a group of individuals for whom the future was very, very bleak, sad, and painful. I'm now going to switch back to India. After the 1830s, when the British set up 3 medical colleges, the first in Calcutta, the second in Madras, and the third in Bombay, medical education, as it was being taught in Britain, came to Indians. And Indian natives, we were called natives in those days to distinguish us from the Europeans who had come into India. So Indian natives at last had access to Western medicine with all its advances. And these 3 medical colleges very quickly, over about 20 years, started producing graduates who could hold their own against graduates from Great Britain. The teachers were so good and the manner of teaching was so efficient that Indian doctors very soon were recognized by the General Medical Council of Great Britain and were welcomed almost as equals by British and other doctors. So I'm going to talk about some of the more recent doctors in India. On the top left hand, you see a gentleman called Bharati Taji. Bharati Taji, his last name was Lad, Bharati Taji Lad. He was originally from Goa. Bharati Taji Lad was one of the first students. He was in the first batch of students that enrolled at the Grant Medical College in Bombay as a medical student. He was in the very first batch of students at the Grant Medical College in 1845. And Bhau Daji Lad won the esteem of his teachers. His teachers eventually grew to respect him because he was so good. He was so good as a man, he was so good as a student, and he was so good eventually as a clinician and as a physician. And Bhau Daji and his younger brother, Narayan Daji, eventually set up a clinic in Bombay. And that clinic, we are told, attracted more patients than were attracted to all the European physicians who were practicing at that time in the city of Bombay. Bhau Daji and Narayan Daji were so good. So Bhau Daji was a great physician and he was a great clinician. But I would like to tell you about another aspect of this man. And that I'm telling you purposely because I believe that what he did, we should be doing as well. And if we follow in his footsteps, we will not only enrich our lives, but we will enrich so many other lives. Bhau Daji became a Sanskrit scholar. Bhau Daji traveled throughout India, exploring Indian archaeology. He collected coins of ancient times. He collected a lot of sculptures and other material, and he wrote about them, with the result that he was known not only in India, but in England and in Germany, where there was a lot of hunger for knowledge about ancient India. He became acclaimed as a scholar on ancient India, ancient Indian archaeology. So Bhau Daji, a medical expert, was also acknowledged as an expert on Indian history and Indian archaeology. And I think that is very important. It is important that we don't restrict ourselves just to the science of medicine. The science of medicine is important. The science of medicine needs a lot of study. And as I emphasized, it needs lifelong study. But it also must be supplemented by interests in other fields. Bhau Daji Lad preferred to study history and archaeology. You may prefer to study art, or you may prefer to study literature, or you may prefer to study dance, or the making of movies or photography, whatever it is. But you must have other interests than mere medicine. I'm not belittling medicine. Medicine is an amazing science, and medicine has a lot through which we can do a lot of good. But we must enrich ourselves in other aspects and other spheres also. Another thing I must tell you about Dr. Bhau Daji Lad is that he was very much interested in learning about leprosy and trying to help patients with leprosy. At that time, there was no drug available for leprosy. There was no dapsone and there were no corticosteroids and there was nothing else. So Bhau Daji Lad worked on an oil of a plant called the Shalmugra plant. And he used Shalmugra oil to treat leprosy patients. He did this remarkably with a series of recording devices, including photography. And so he maintained such beautiful records that even today, we can study some of those photographs and some of his records. And he showed how Shalmugra oil produced a certain amount of improvement in the condition of leprosy patients. And so he, in the field of medicine, he had subspecialized in the treatment of leprosy, in which he also became an international authority. So a remarkable man in many, many ways. Fortunately for us, His biography is written by an eminent scholar called Dr. Priolkar, who is now dead. But I would strongly recommend that you try and get hold of Priolkar's biography of Bharati Taji. And of course, there are a lot of other papers and essays written on him. There is a University of Bombay commemoration on an anniversary of Bharati Taji, which contains a lot of essays that have been combined together. So I would recommend that you look out for these books and read them, because he was an inspiring figure. Next to Bharati Taji is Anandi Joshi. I'm sure all of you know about Anandi Joshi. She was the first Indian woman to become a physician. But she did not learn medicine in India because at that time, women were not still allowed entry into Indian medical colleges. So she had to travel to Philadelphia, to the Women's Medical College in Philadelphia, and she graduated in medicine from Philadelphia. Very soon after she left, Madras Medical College opened its doors to women. And then Calcutta and Bombay followed. So by the 1880s, all three medical colleges, by the end of the 1880s, all three medical colleges were admitting women. But when Anandi Joshi wanted to be a doctor, there was no medical college in India that would admit her. And so she went to Philadelphia. Now, in Philadelphia, she won the respect of her teachers. She was so good that all her teachers loved her and respected her. How do we know that? Because they have left written tributes on Anandi Bai. And when Anandi Bai died, as she unfortunately did soon after she came back to India, she had gone to study medicine in Philadelphia because she found that Indian women would not go to male doctors. They would rather die at home rather than get examined by a male doctor. And so she went to Philadelphia to become a doctor so that she could look after her fellow country women and help them as a woman medical doctor. But unfortunately, as I say, she died soon after her return. She died of tuberculosis. And when she died, amongst the tributes were tributes from her teachers and her principal of the Women's Medical College in Philadelphia. So we know that she was a greatly respected person. Had she survived, we don't know what miracles she would have achieved. It is only conjecture because she did not survive. Next to her is not an Indian physician. He is actually a Russian who eventually traveled to Britain and then traveled to India and many other places. But he did some remarkable work in India. Waldemar Haffkine, after whom the institute in Parel is named, the Haffkine Institute. Waldemar Haffkine worked on cholera and he worked on the plague. I'm just giving you two examples of what he did. He created the first cholera vaccine in Bengal. While cholera was rampant in Bengal, the government of India had invited him from England to work on cholera and to prepare a vaccine. And so he prepared this cholera vaccine. Now, there is a great lesson to be learned from his discovery of the cholera vaccine. He did not take the vaccine and inject it into a poor Indian person. He could have. He could have easily said, now here's my vaccine, find some poor person from the streets and inject this vaccine. We'll see what happens. he injected the vaccine into himself first. At that time, there were no phase 1, phase 2, phase 3 controlled trials on vaccines or anything else for that matter. So you just discovered something and you used it. The smallpox vaccine was used directly on a patient. The cowpox vaccine, which was used by Edward Jenner, was used directly on Sarah Nelms, who was a dairy maid. And so these new innovations were directly used on patients without any trials. And so Haffkine would have been in his right to say, oh, just catch hold of any old Indian, after all, what does it matter? He's just an Indian. Get him and inject this vaccine into him. But he did not say that. He said, give me the vaccine first. And so he took the vaccine. There were no ill effects. Then he said, now give me this vaccine in double dose, twice the dose which was necessary. And I want to check that it still has no ill effects. And only when the double dose of vaccine had no ill effects, that he said, now you can use it on other individuals to prevent cholera. He discovered the plague vaccine while he was in Bombay. And he did the same thing. At that time, he was working in the JJ hospital in what is known as the Petit laboratory. Unfortunately, the Petit laboratory today is no more a laboratory, it's a blood bank. But in that Petit laboratory building, which is now the blood bank, he developed the vaccine against plague. And once again, he told his colleague, inject this vaccine into me first. So this was the hallmark of a great physician, of a great scientist, and a great researcher. If the risk has to be taken, I will be the first person to take the risk, not some Tom, Dick, and Harry from the streets. So I think there are many reasons why we should learn about Haffkine and his work. There are many, many more things that he achieved, but I'm just giving you a few interesting facts about him. I've already spoken about Dr. Vegas, and I told you how he identified the first victim of plague in the 1890s, and the government of Bombay refused to believe him. And so the plague epidemic grew and eventually killed so many in Bombay. And it was only later that they recognized what Vegas had said and accepted that it was true. Why did they not accept Vegas's description in the first place? Because he was an Indian, he was a native, he was not a European. If a European had made the same statement, they might have accepted it. But this was an Indian. What did an Indian know? I mean, that was the kind of psychology that the administrators and the higher ranks of the government had at that time. On the bottom left is Dr. Brahmachari. Any Bengali worth his salt will sing praises of Dr. Brahmachari for his work on Kala Azar. As with leprosy, as with cholera, as with plague, Kala Azar was a neglected disease. Very little was understood about its treatment. And it was Dr. Brahmachari who, for the first time, used antimony preparations for the treatment of Kala Azar with success. And because of his successful treatment of Kala Azar, Dr. Brahmachari now is included in the Hall of Fame of physicians in general and physicians in India in particular. Next to him is Dr. B.C. Roy. Dr. B.C. Roy gained eminence as a physician. He had a very good practice in Calcutta. Eventually, he went into the field of politics under Gandhiji's influence. He was one of the physicians that Gandhiji consulted whenever he was ill. And he finally rose to be the chief minister of Bengal. The reason why we should respect him is because of his achievements in promoting health in the state of Bengal. He did a lot to improve public health in Bengal. And as the health minister, as the chief minister, of course, he had a wider field of influence because he could interact with other chief ministers of other states and try and propagate his ideas in their states as well. So he did a lot of work in the field of preventive medicine and public health. Dr. Dr.M.V.L.Kothari, I wanted to talk to you about him. We in the KEM Hospital and GS Medical College must be especially proud of him. He is one of our gems. What I did not tell you earlier was that he too was a historian of medicine. He was very fond of the history of medicine. He's published at least 3 books that I can think of on the history of medicine. And he delivered lectures on the history of medicine, not only in GS and KEM, but also at JJ. And in fact, it was his lectures which in part inspired my wife and me to get interested in the history of medicine. We were already primed. I had already been primed about the importance of the history of medicine by Dr. Ashok Vaidya, who is now a retired clinical pharmacologist of national and perhaps international eminence. He's fortunately with us even now, and he is one of our trustees for this division of humanities that we have in GS Medical College and KEM Hospital. And he had already primed me on the importance of the history of medicine, and Dr.M.V.L.Kothari's lectures stimulated the fire, so to say. Extreme bottom right hand is Dr. Naushir Antya. As you can see, he was with us till quite recently. He died in 2007. His career was that of a plastic surgeon. He was professor of plastic surgery at JJ Hospital and Grand Medical College. His work in plastic surgery by itself would have gained him a lot of fame, did gain him a lot of fame, particularly his work on patients with leprosy. He trained with Sir Harold Gillies, who was one of the great British plastic surgeons of that time. And Sir Harold Gillies was his teacher. Antya worked with him. And when Antya was coming back to India, Harold Gillies asked him, "What are you going to do in India?" So he said, "Well, I'm going to do plastic surgery. Whatever I've learned from you, I will try and implement over there." And Gillies cautioned him, India does not need augmentation or reduction of breasts. India does not need nose jobs. The poor of India have many, many deformities and many, many abnormalities which need correction. Concentrate on those deformities and on those ailments that your poorest patients are suffering, because their deformities are interfering with their livelihood. Augmenting or reducing the size of breasts or nose jobs are just cosmetic. They don't help the person improve livelihood. You have the potential to improve the livelihood of many. Do that. And Antya took this message to heart. And so in JJ Hospital, which is, as you know, a government hospital, a public general hospital, he started admitting and treating patients with leprosy. As you know, leprosy also affects the face. The most crippling effects, of course, are on the hands, which become like claws, and on the feet. But the bridge of the nose disappears, the nose sinks, eyebrows disappear, And there are a lot of facial deformities as well. And so Antya, the plastic surgeon, used the expertise he had gained from Harold Gillies in England to try and restore facial normalcy, as near normalcy as possible, to these patients with leprosy and leprosy-affected faces. And he achieved a fair amount of success in his work. He was able to recreate eyebrows which had disappeared in leprosy. He was able to bring the shape back to a near normal shape instead of that sunken bridge which so readily identified the leprosy person. And he was able to do all these. And so he achieved some degree of fame. And the Royal College of Surgeons of England, the same Royal College which I told you about when I was talking about the Hunterian Museum, the same Royal College had a series of lectures called the Hunterian Lectures. These were lectures named after John Hunter. Antya was invited to deliver a Hunterian oration on his work on leprosy of the face. And Antya delivered this Hunterian oration in a manner in which he commanded admiration from all the other experts in the field who had not thought of these kinds of operations to restore normalcy to the face. He also became friends with another doctor who was also working on leprosy, but in Vellore, in the Christian Medical College, Vellore. His name was Paul Brand. He was actually an Englishman who eventually settled down in Canada at the end of his life. But at that time, he was working as professor of orthopedics at the Christian Medical College, Vellore. And Paul Brand was reconstructing hands, the hands of leprosy patients. So here you have one center that is recreating normalcy in hands in leprosy, and you have another center which is creating normalcy of the face in leprosy. Naturally, these two became fast friends and they respected each other very greatly. And that was, now, as with many of these extraordinary and far-sighted individuals, Antya did not stop with medicine and surgery. Towards the end of his life, he went into rural welfare. And so he established centers in two areas in Maharashtra, where he attended to villagers who had no access to public health. And he set up these rural centers which are still functioning, even today. And they continue to help the villagers that Antya started to help. He was one of the founder members of the Association of Rural Surgeons of India. We have such an association. And many of these rural surgeons, who are in fact remarkable surgeons because they are doing some amazing work under very, very difficult circumstances, they have banded together to form this organization. And Antya helped them as a founder member of the Association of Rural Surgeons of India. So a multifaceted personality with many, many contributions to his credit. Then there are those who are working at the grassroots. It would be wrong for us only to worship, hero worship, individuals who are working in big hospitals and big centers with lots and lots of facilities. We need to honor these people as well. And here are some examples. You may be knowing the work of each and every one of these individuals. Some of them have come and talked to our students and to our residents at the KEM. I distinctly remember Dr. Bavarskar's talk recently. I remember Dr. Abhay Pang's talk recently. So some of them have come and spoken to us and to our students and to our residents. Each one of these is a hero. Each one of these has done absolutely admirable work. On the extreme left, we have a couple, Mabel and Rajnikant Arole. Amongst the earlier workers who went into the villages and the rural areas and helped people there as far as health and medicine was concerned. They were awarded the Magsaysay Award for their work. The person in the center, I don't think needs any introduction at all. That is Baba Amte. I think everyone knows about Baba Amte. It is unfortunate that towards the end of his life, he developed a spinal problem for which he needed surgery. And unfortunately, after the surgery, he was more or less bedridden. So his own personal contributions to rural public health diminished a little bit at that stage. But that was towards the end of his life. For most of his life, he had done remarkable work. And like so many others that we have talked about today, like Bharati Taji, for instance, or like Dr. Naushir Antia, for instance, Baba Amte also treated leprosy patients. And he was very, very careful about how these patients were looked at. He would be very angry if somebody looked down on a person because he had leprosy. Just because he had leprosy was no reason for anyone to consider themselves superior to them or look down upon that individual. And he was very strict about that. Of course, he did a lot of other work for the leprosy patients as well. Even as he was aging, he started thinking of other areas in the state of Maharashtra where the kind of work which he was doing at his center could be duplicated. So when his son Prakash graduated from the Nagpur Medical College and wanted to join him, he said, no, don't come and join this center. This center is now functioning quite well. We have everything arranged now and everything is going smoothly. You go to another center and I will show you where. And he took him to a relatively remote path outside Nagpur, which was in a hilly area where there was no medical help for hundreds of kilometers. And he told him, look, set up a center over here. Help the people in this area. Most of them are tribals. Most of them live in forests. Most of them have no occupation which earns them any income. They have no doctors. They have no medical help whatsoever. Help them. And Prakash and Mandakini, his wife, who is also a doctor, both of them followed his advice and set up a center which today itself is an internationally accepted center for healthcare. It would take me a lot of time to tell you about their achievements, about their difficulties, and about what they were able to do against tremendous amount of odds. But fortunately for us, there are many YouTube videos on Prakash and Mandakini Amte and their work. So I would very strongly recommend that you go to YouTube. These are easily available. Just type the words Prakash Amte or Mandakini Amte and you will get access to those YouTube videos. And I assure you that you will be inspired by what you see. Even in this photograph, there is a lot which will inspire you. Look at Prakash Amte. He doesn't wear a suit. He doesn't wear a tie. He doesn't wear a white coat. He's dressed in a banyan. That's it. And whom is he examining? He's examining a child who's malnourished, with skin and bones, And he's going to try and do everything that he can to help this child. And by his side is his wife, equally concerned about that same child. And this is just one photograph. When you see the YouTube videos, you will see the full impact of the work that he's doing, conditions under which he's working, and what he has set up in the face of all these odds. Abhay and Rani Bang, left hand side of the screen at the bottom, have also been working in the rural areas. They have set up measures for early diagnosis of illnesses in little children, in absolutely little babies, newborns, and infants. They have set up mechanisms by which non-medical individuals will make an early diagnosis of disease. As you probably know, an infant, if it gets dehydrated, can very rapidly worsen and die. So early diagnosis, if it is developing pneumonia, if it is not diagnosed and treated early, it will die. So by making an early diagnosis by non-medical individuals possible, he has saved countless lives of children. And so that is one of his one of the contributions of this couple. They have been acclaimed, they have been honored by international organizations like UNICEF and WHO and many, many other international organizations. So their work has been of high caliber, properly documented, and therefore authenticated. And their techniques are now in use in several places in underdeveloped countries in the African continent and many other places. Abhay and Rani Bang. Dr. Himmat Rao Bavaskar in the center. He has spent his life working again in a rural, neglected area. He has worked, his most famous work is on toxins from scorpions and snake bites. And at a time when in that area, where there were no other doctors, he was the only doctor at that time. If the patient could not reach him in a certain time, the patient would die of a scorpion bite or of a snake bite. And he has set up, almost single-handed, a system whereby anyone can find a doctor whom Dr. Bavaskar has trained or who has been trained at other centers and who will treat scorpion bites and snake bites. Because Dr. Bavaskar has recorded and published his methods of treating these toxic venoms. And because they are now well known and because they are well accepted, because they have been verified at many, many centers, now it is within the reach of any family physician to be able to treat successfully a patient with a snake bite or with a scorpion bite, unless, of course, the patient comes in extremis, when very little can be done. Dr. Bavaskar remains active. He continues to have an inquiring mind and he's forever thinking of new things to work on. And he is an inspiration, especially in the state of Maharashtra. But he is well known now internationally. He's well known particularly in Great Britain because his papers have been published in the Lancet and many other international journals. Dr. Rao in Bangalore is a family physician. He too has worked essentially for the poor. And he also has several achievements to his credit. But the one achievement I would like to put forth to you is his creation of a little club in his area, in his region. And what he has done is to create like-minded individuals, get together, like-minded individuals, who are not interested in making money, who are there really out to help poor patients. And they have some kind of a weekly meeting at which they exchange their own experiences. So each one learns from the other. They go through important essays or papers which have appeared in the journals during the past week. And they have their own means of catering to those who cannot afford to pay. So this is a kind of a widening circle of experience which is being generated by him. He also publishes in the Journal of General Practice. We have a Journal of General Practice in India, and he publishes there. And he talks at conferences and at workshops for general practitioners. So he's another one of the unsung heroes who works for poor patients, for rural patients, and for tribals. I've listed here a few references which you might like to look up. I'm going to leave this slide on the screen. And this is just 3 references out of several thousands which are available. The first one, Kutumbia's Ancient Indian Medicine, gives you a very good summary of the history of medicine in ancient India. I've drawn quite a bit of my material from Dr. Kutumbia's book. Dr. Kutumbia was a professor of medicine. He retired as professor of medicine at the Christian Medical College, Vellore. Heinrich Zimmer was a German scholar, and he has written on Hindu medicine. And Kenneth Zisk is a recent researcher, contemporary of ours, senior person, who has written several books and papers on ancient Indian medicine. And I found that this one, which is easily available in India, might be of interest to you. So to summarize, I would like to once again emphasize that the history of medicine is not a dead, boring subject. It is full of life. You can find everything that you want in the history of medicine. If you study it, you can find everything that you want. You can find drama. You can find heroism. You can find murder. You can find, of course, the saving of life. You can find public service. You can find literature, like Sir William Osler, for instance, was a great literary individual. And there are many, many other physicians who have been great literary figures. You can find comedy. You can find tragedy. So you can find everything that you want in the history of medicine. It is not a deadly, dull, boring subject. It's a very exciting subject. But more important than that, it is an inspiring subject. When you read about an individual who said, "Give the vaccine to me first," and then says, "Give me the same vaccine and twice the dose, and make sure that it is safe on me before you give it to anybody else," you cannot fail to be inspired by him. There are many, many other such examples. If you have the time, look up the story of Dr. Koornand, Cournand, Dr. Koornand, who devised the technique of catheterizing an artery, or catheterizing a vein and putting a vein into the chambers of the heart. First time ever. No one had ever done that earlier. And what is interesting is the manner in which he did it. So look up André Koornand and how he developed the science or techniques of catheterization of the heart. I can give you other examples, but I think I will leave you to make your own discoveries in the areas that you are interested in. So, the history of medicine is important, is inspiring, and is certainly not boring. Secondly, we have many heroes in medicine, many heroes. I mean, you can't really count them. There are so many of them. Many of them have lost their lives in the process while treating patients in epidemics, while doing experiments and so on. Many of them have sacrificed their lives. So they have given us advances in medicine at the cost of their own lives. There are such examples also. So there are many heroes in medicine. We need to learn about them. We need to know about them. We need to honor them. We need to respect them. What do we hope to achieve by this kind of a study? We hope, first of all, to be better physicians. We hope to be individuals who will treat our patients the way in which these great doctors have treated their patients, with compassion, with empathy, with sympathy, with love, with affection. And even if it is risky to ourselves, we will still treat the patient. That is what we hope to achieve. So I'm going to stop this talk at this stage. And I do hope that you have found it of some interest. And what I would really be happy at is if you were to start a study, your own study of the history of medicine, the literature of medicine, and so on, that would be really great. Thank you. I think we should stop now. No, your mute is off. Your mute is on. You have to put the mute off. Madam? Yeah, now I can hear.
Hello. Thank you, sir, for your extensive study and then making it brief for all our students. I again thank you for that, and you have given the references for the students so they will be inspired to read that. And again, once again, we have troubled you a lot because of our internet problems. So thank you, sir.
Not to worry. I think problems are going to be there all the time. And I'm sorry I exceeded my time because I noticed here that there's a reminder that we are in excess of the booked time.
It's all right, sir. Because this lecture was, and it was in Zoom, so YouTube, we had to continue. Thank you, sir.
Thank you. Thank you very much.
Students have to come back to the practical and theatre